I am Dr. Yusuf. I am a cardiothoracic surgeon at Apollo Hospital, Greaves Road, Chennai. How big is a scar after MICS, minimally invasive cardiac surgery? Yes, the open sternotomy scar or the open CABG scar is about 15 to 18 centimeters, whereas the minimally invasive CABG scar is lot less. It's about 3 inches, 7 to 8 centimeters. It is 1/3 of that. Now with robotic assist CABG, the scar is even less. It's just about 5 centimeters. So what is mini thoracotomy? Yes, so that is the incision made on the left side of the chest, 7 to 8 centimeters, to perform minimally invasive CABG. So what long lasting anesthetic agent you use above and below the mini thoracotomy incision? Yes, so usually after this mini thoracotomy or even the robotic procedure, we use local anesthetic, which is the common bupivacaine with the combination above and below the ribs. It doesn't last very long. It lasts for few hours. By then the patient is taken off the ventilator, and then we use intravenous painkillers for the first couple of days, because this pain doesn't last as long as the open incision because there is no bone cut here. And with minimally invasive, we have to retract or pull the ribs apart to see through, because only the skin and the muscle underneath is cut. Whereas with robotic assist, even that is completely avoided. So the patient hardly has any pain even from day one with robotic assist, because it just holds. There is no pulling of the ribs at all. The robotic camera and the hands go into the chest and operate. That is an added advantage of robotic assist CABG over minimally invasive bypass surgery. So which specific operations can be performed through a minimal incision? Yes, in this day and age, almost all adult cardiac surgery procedures, CABG or valve procedures, can be performed through the minimally invasive cardiac surgery. But not every patient is suitable. In my practice, more than 80% of the operations I perform through these approaches. Am I a suitable candidate for minimally invasive procedure? Yes, most patients this day and age are. As I said, in my practice, it's more than 80%. But we have to individually see every patient. There are things that we take into account. The anatomy of the blockages, which is looked through with the angiogram, the echocardiogram report to assess the heart function, and the other parameters, blood tests. So overall, we look at these parameters and examine the patient thoroughly before subjecting them to minimally invasive procedures. How long is the recovery after this type of surgery? Yes, that's an important question, because with minimally invasive surgery, the key advantage is in the early recovery. With open sternotomy CABG, the recovery time is about 3 to 6 months, depending on the age of the patients. Whereas with minimally invasive cardiac surgery, the recovery, hospital stay is shorter, it's about 3 to 4 days, and recovery is also very short. In 2 to 3 weeks, they can get back to full normal activity, because there is no bone cut. All that needs to heal is the skin and the tissue underneath. With robotic assist cardiac surgery, it's even less. Hospital stay is just 48 to 72 hours, which is 2 to 3 days, and they recover within 2 weeks. How much pain do you feel after minimally invasive CABG? So compared to open CABG, patients hardly have any pain. So just with those intercostal blocks that we give and the intravenous painkillers for the first 2 days, they usually are comfortable. And when they go home, we usually give oral tablets for a week to 2 weeks. So that's more than adequate. They have lot less pain compared to open CABG. What happens if I don't get the surgery done? So for patients with coronary artery disease or blockage in blood vessels, it can lead to heart attack or it can be fatal, life-threatening death can occur. In patients with valve problems, it again leads to heart failure over a period of time, which eventually leads to death of the patient. Today we have answered questions related to minimally invasive cardiac surgery, MICS. I hope we have answered the common questions. My message would be stay healthy, stay safe, stay informed, and please seek specialist advice if you have any of the above problems and want anything clarified before taking appropriate treatment. Thank you.